everyone. Welcome back to the next episode of the Charter School Connection podcast. Today is Friday, 14th of April, and I'm Jared. I'm here with a new guest speaker that we have, Dale.
Good morning, Jared. Nice to be here.
Great to have you. So you represent Health Works Academies, which does a little bit of a unique function for students. Is that right?
That's right. We are a talent pipeline program in the health sciences. So we are a high school to higher program. And we have three goals. We are a nonprofit organization and our mission includes three goals: increasing the number of students going into the health sciences as in careers, building diversity in our next generation talent, and including the leadership skills that are required for success in next generation talent, communication, ownership of the whole, commitment to excellence, teamwork, all of those things that contribute to high performing teams. And we feel that that's an important component for high school students to know.
Yeah, for sure. Getting guidance at an early age can be very impactful to having a wonderful career and a great life long term. So you had founded Health Works Academies yourself, is that correct?
Yes, I did.
What was your motivation and kind of like the pathway to starting Health Works?
The vast majority of my career has been in healthcare. And back about 15 years ago, it occurred to me, and particularly working in internal medicine, where about 55% of our patient population was geriatric, and understanding that what the future looked like in 2020 and beyond, that a third of the nation's physicians would be over the age of 65. That was pretty scary because we didn't have a sufficient pipeline to replace them, but also to address the escalating needs. We have a senior population that's living longer and more of them, and the highest population that accesses healthcare. So that was really the genesis for HealthWorks Academies. And then what I recognized was we have an unsustainable cost trajectory. We have a decline in students graduating from STEM programs in college. We've told kids that, they have to graduate from college and, they'll have a great career. But STEM is hard. And so when they go to college programs in STEM, the dropout rate is very high, and particularly for Black and Hispanic students. And yet in the health sciences, we need a population of professionals that reflects the populations we serve. And currently, we don't have that. And it shows up in the disparities in healthcare. And so our mission is to, number one, introduce students to careers in clinical medicine, biopharma, medical devices, healthcare technology, graduate level research, behavioral health, business and finance in healthcare, which is very different from most industries, and healthcare law. And so we represent a wide umbrella, if you will, of the healthcare industries. And there are thousands of careers in these industries that students in high school know nothing about.
So you foresaw a need like way out into the future to, I guess, supply like a large pool of adequate, well-trained and diversified individuals to kind of fulfill that need, right?
Mm-hmm. Yeah.
How long ago would you say you kind of had that realization?
Oh boy. The first awareness was 2006. Looking at the trajectory for the population, the aging population, growth of diverse populations. We have several majority states now, where minority populations have grown exponentially, and so now the minorities are actually the majority in those states. And but if you look at the professional talent in the health sciences, if you it's not a match. And if you're looking for a doctor, you're looking for healthcare. Healthcare is personal, right? And so there's trust, and there's an implicit trust and buy-in and acceptance and inherent adherence when your professional looks like you. It's a very different experience. And, for many of us, it hasn't been an issue, but for many of us, it has. And so we want to level the playing field and make sure that students of all backgrounds have access to these careers. And we like to say, if you can't see it, you can't be it, right? Um, so for those students who um, don't have somebody in their sphere of influence, and I would argue that not any student has somebody in their sphere of influence in all of those industries, right? So if you want to go into, if you have somebody in clinical medicine, that's great. But if you want to go into healthcare technology, they might not be able to help you, right? So what we do is we source industries in all of those practice areas and connect them with students and create a talent pipeline. Um, so
Gotcha. So I'm a little curious a little bit more about how you guys work individually with the students. Is your program something that the students seek out and reach out to you on their own, or are you guys kind of, I guess, contracted by a high school that utilizes your services to aid their students?
mhm. We work directly with schools
Okay.
and we connect high schools and industry. And we will go into a school. We do have a 4-year STEM curriculum that's embedded with problem-based learning and social emotional learning. That has been difficult, honestly, for schools to adopt after COVID, because the residual effect of COVID has been, really tough on teachers. But we do have a curriculum that's written to Pennsylvania standards. Um, and we have a suite of offerings, so that the curriculum is not mandatory. It is optional. But what we do is we offer a suite of panels. We have our masterclass panel, which is one company that populates a panel in a certain industry and different careers in that industry. And in a 90-minute program, we bring that virtually to the school. And what the students walk in with and what they walk out with after 90 minutes is a game changer. They see a whole different future. They have professionals who talk about their time in high school and what it was like, and where they went to school and what they were thinking at the time, and then how they transformed their careers into what they're doing now. And the learning and the ability to transfer skills and things that actionable steps that they can be doing now in high school to improve the trajectory and the velocity of their careers is really invaluable. We have our industry panels, which is made up of professionals from different companies talking about their careers around a certain industry. We have panels around going to college or not to college, and different opportunities for paying for post-secondary education and avenues that students can take and places to think from. There are many, many companies that will support your education. There are companies for whom nobody pays for an MBA, which a lot of students don't know. They take on a lot of debt, not realizing that companies will pay, for your advancement. So we want to share all of those opportunities with students so that they know what the landscape looks like when they're making their post-secondary education and career decisions.
Sounds like you guys provide a lot of answers to questions that students may not even know they have.
Exactly. So in addition to, if you can't see it, you can't be it. So obviously, if you don't know that these careers exist, you don't have the opportunity to create that pathway. But between high school and career, there are a lot of opportunities that students don't know, and they don't know what they don't know. So this is an opportunity to share with them what other people have done, that the paths that they've taken, what they thought they had to do with a particular degree, and how they transferred those skills into an industry they never thought that they would work in, and doing really, really meaningful work. And the stories of what they've accomplished is just amazing.
That's great. I was curious if you have like any kind of success stories or examples of a student that you might know. Is that something that I might be able to ask about?
Sure. Well, one of the things, in addition to the panel programs, and we have a whole suite of those, we have a mentoring program, and that follows the panel presentations, where students have more of an idea of what direction they want to go after high school, and our program is geared for grades 9 through 12. So over that 4-year period, they have experience of a great many industries and professionals and stories. And so by the time they're ready to make those post-secondary decisions, they have a wealth of background to draw from, to assist, in their decisions, and what industries they want, to in careers they want to follow. But in the mentoring program, they get a one-on-one program for a number of weeks with an industry professional. And I'll give you an example. We had a senior who loved math and loved technology, wasn't quite sure how to meld the two, or what a career would look like. And we had exposure to vice president of supply chain in pharmaceuticals, and he became his mentor, and saw the combination of math and technology and how it was applied in supply chain. And this was on the heels of the pandemic, when the supply chain was really challenging, right? So that was a great learning opportunity. And now that he's graduated from college, from high school, he's in college, has gone to see the company in person and do the tour and see, what they produce, and what a day in the life looks like. And now he'll be doing a paid internship this summer.
Well, that's
And
all.
and it's the hope of the executive in the company, that he'll continue his education and stay connected with the company and ultimately work there.
Well, that's incredible. And it almost sounds like you're also doing a service for the industry, right? You are kind of giving them easier access to quality individuals that they would be willing to invest in to, further their endeavors as a company.
Absolutely. We consider ourselves a bridge. So if you think of high school in a silo, you think of industry in a silo. But really, the industry industries are growing, the trends are changing, the needs are changing, and they need a constant pipeline of talent, particularly with the decline in STEM graduates in college. And so there's great competition for professionals across the board in all of those industries that I spoke about. And one emerging technology is cell and gene therapy, which is very competitive for talent. And talk about cell and gene therapy to a high school student, or counselor, teacher, principal, superintendent. They typically don't know what that means. So our industry partners are really important, because they inform us of the trends and what they need, and where the deficiencies are, and the direction that they're going. And then we communicate that to our schools and our students, to let them know where the demands are and how to prepare for them, and then connect them through the panel discussions, so that they can hear from the professionals, what those careers look like, but also what the future looks like. And so, being a bridge, we connect, stakeholders on both sides, and provide a valuable service, both for our schools and for our industry partners.
Um, with your description of being a bridge, I think that's a great analogy and an incredible service. I'm curious to know if you guys are more active on one side versus the other. So do you kind of interact more so with students during the high school period or after they graduate and you're trying to like help connect them with the industry? Would you say you're more active in one side or the other of like their graduation, either while they're still enrolled or post graduation?
No, our focus is get them early. So we start in ninth grade. With our panels, we can start anytime. If you've got senior students or junior students, and you want to bring them into the program, we can do that. But we make the panels open to grades 9 through 12, and we charge by the panel, not by the student. So our mission is to get as many students educated in these fields as we can. So we invite the schools to invite as many students as are interested in a STEM career. And maybe they don't even know that they're interested in a STEM career. Just come and check it out and listen to the stories and, listen to the academic pathway, and you might find something that you never considered. But we make it affordable to schools. Our mission is to engage as many students as we can in in an interest, and then take that interest and foster it and grow it and support it. And then when they're in their high school, their senior year, to pair them with a mentor or mentors in an industry of interest, in a career of interest, so that when they go through their post-secondary activities, and typically it's a college path, but maybe not, they have somebody in their sphere of influence now who is in industry and can help them. And like I said, STEM is hard. And so, giving them the encouragement, keeping them on track, talking to them about the things that are important, how to manage their time, how to best use their study skills, the opportunity to reach out to a network, in school to work together to get through these courses. Those that kind of mentoring is really invaluable for every step of the way. And it serves two purposes. It allows for students to be more successful because now they have an advocate and somebody who is helping them think through and work through their college years. They are also learning invaluable skills in communication, in how to work with professionals, how to be accountable for their time, how to follow instruction and report back. Those are all skills that are critically important in business. And they're also learning how to work for the culture of the company. So the company is looking to invest in them and hire them, and that investment is that mentoring component, that they're taking these professionals to during their business time to work with students, right? But companies also know the cost of a cultural mismatch, right? So you can hire somebody on skills, and if it's not a match for culture, then it just doesn't work. And so it's an opportunity then for the companies to make this investment in their future workforce, foster the growth and development of that individual, but also create the awareness of the culture and how to work so that when they are employed, they're a good fit.
Yeah, so having a good fit for the people that you're going to be serving is definitely very impactful. You had mentioned that you work with a number of different corporations in the health industries. Are there any like in particular that you guys work with? I guess we know you work with school. Are there any like other in particular companies that you guys work with?
We work with pharmaceutical companies, biotech companies, clinical medicine, medical devices, um, behavioral health is an industry that desperately needs professionals, and students typically don't know what those careers look like, and just like all the companies, they need PR and HR and, finance and, all different kinds of careers in those industries, as well as direct patient care. So, um, and we work with everything from, companies with 500 people to tens of thousands of people, global companies, as well. And they all have amazing benefits. They also have amazing cultures and growth trajectory, but they all have one common theme, and every one of them is dedicated to having people live their best life. And there's something very special about having a career where you also are contributing to a better society. And that's very meaningful for us.
It's very fulfilling for the individual, for the student as well. Um, do you see any of the students tend to gravitate towards other portions of the STEM field that may not be related to health, or do you guys mainly just work on the health aspect? Because there's also like engineering and manufacturing and stuff like that.
Well,
Or
you know what? It's all related, Jared. So
yeah,
when you think of manufacturing, think about pharmaceutical manufacturing, right? There's a huge need in pharmaceutical manufacturing, huge. And we saw it during COVID. We could develop the vaccines based on the science that we already had, and it changed the trajectory of the pandemic because we had the technology to build upon, to create these vaccines, but we couldn't turn them out fast enough because of our deficits in pharmaceutical manufacturing. Pharmaceutical manufacturing has very strict protocols, and so um, in working to produce something as quickly as we needed to get this vaccine across the world was a huge task on a system that wasn't set up to manufacture that quickly. And so, bravo to the pharmaceutical companies who were really innovative and worked together to produce as much vaccine as they could. But the deficit continues. And we have students that want to go into tech. Well, that's great because there's so much opportunity in tech as it relates to healthcare. Look at the Apple Watch that can check your heart rate and your respiration. Look at the wearables, that can report back on all different body systems, and as a if you're a runner or you're exercising. Those are really great in the moment feedback opportunities that you can look in terms of endurance and sustain improvement. And it goes way beyond that. Look at what we're doing in AI and healthcare and predictive analytics. It's absolutely changing how we look at research, how we look at utilization of facilities and workforce. If we know that there are ebbs and flows of certain demands, we can operate more efficiently and at lower cost. So there's all kinds of opportunity, in engineering and healthcare. There are thousands of careers in where biomedical engineering and software engineering and in healthcare. I could go on and on. So many opportunities. So really anything, when we talk about STEM, science, technology, engineering, math, we have an extra M for manufacturing because it's that important.
right. And that's the beautiful thing, I guess, about the healthcare industry. It's just so broad, right? There's so many different ways, and it is all interconnected. Like people that like to work on computer programs, I mean, that's patient information systems that hospitals use right there.
Yep.
It's
And
definitely
cybersecurity is a big issue. If you have if you're in a hospital room and you're connected to a device and that, or, a monitor, that monitor feeds into the computer and the medical record, that then becomes hackable, right? So, all kinds of things to consider. And so, hackers are getting more and more sophisticated and we have to stay one step ahead. So
Right.
that's an area that is very much in need. And it's 24/7. So the need is always there.
Right. Is it can be very overwhelming for a new student, especially a very young person entering a new career, to understand everything that is available. I think it's great with the direction that you guys are providing in order to help kids make educated decisions about their futures. I'd like to ask you a little bit about any kind of struggles you might have had when it came to founding HealthWorks.
Mhm.
What year would you say you guys became official?
I would say about 2014. Our bylaws were, as I said, we're a nonprofit. Our bylaws were created before that, but that was when we got our first significant funding and were able to develop the curriculum and develop our board and, really operate as a company. I think that the vision for HealthWorks was to create an awareness of careers across, this broad industry, and next generation skills, and increase the numbers of students and diversity, in the number of students. But it was also very important that students have the academic proficiency to be successful, and that's why we started with the curriculum first,
Right.
because we understood that STEM education, it isn't present in some schools, and the quality of STEM education varies significantly between schools. And so we wanted to be able to provide a high quality STEM curriculum that could be implemented in any school, urban, suburban, rural, any geography, um, public, private, charter, faith-based. We're not at virtual schools yet, but we could be. Um, but we wanted to level the playing field so that if our goal was to include students from all backgrounds, we had to be able to provide this to all schools in all backgrounds.
Be a multi-tool.
But what happened with COVID, was that the sudden shift from in school to virtual to hybrid and back and forth, and then all of the complications with the pandemic made it very difficult to implement a new curriculum. Teachers were just overwhelmed. They still are. But just catching up from the learning loss from the last 3 years has just been astounding. So, if there's any struggle, I would say that implementing the curriculum has been the hardest thing. But along with that curriculum, our model was in-person visits to industry, to see a day in the life and hear the stories, and so that didn't happen during the pandemic. But the good that came out of it was that we developed these virtual panels, and so now our panelists come from anywhere in the country. We could have them from anywhere in the world, and our panels can be delivered to any school anywhere as long as they have an internet connection and a Zoom link, and that exponentially grows our reach for schools, and it makes the entry point very, very easy.
So across the US, do you guys tend to operate more actively in certain states over others, or certain geographic areas over others? Where would you say most of your um, work is done?
Um, we have tradition to date. We've worked in New Jersey, Pennsylvania, and Delaware. That's where we currently work. But given our model, it can be implemented anywhere. And what we see ourselves too is a competitive advantage for schools. We offer something that is a unique value proposition for schools, and it serves two purposes. It differentiates the school, for focusing on, for the opportunity to expand students' awareness of careers, their preparation, their connection with industry, and the likelihood that they would be more successful in a career that they've had this opportunity to explore and that they're really connected and dedicated to. Um, and, you know, both my kids went to private schools, and we know that successful alumni, support schools, and, they do more when they make more. So, we want to impact that trajectory as well. Um, and, um, with these panels, with this, the virtual component that, our mentoring program can be virtual as well. So there's no limit on where we can bring this program.
I was imagining that there might be some sort of limitations when you said that you do a lot of in-person meetings. So I was curious if there's like a lot of travel that you guys do with going around, but I'm sure just operating across those few states, um, that can certainly take time visiting schools from all over.
Well, it doesn't need to be that way. That was the way it was before the pandemic, but now everything is virtual.
Oh, that's true.
So
Yeah.
so I can meet with the schools. I can introduce the program. We design the work that we do together. We have a suite of panel selections and industries. So we select, from year to year what the school would like to do, and then we set the dates, and then we go from there. We source the panelists. We do all the prep work. We do a run of show. We provide a flyer for the schools to circulate among the students so that they know what they're going to be talking about, who they're going to be meeting, and the school just sets up a venue for the students to participate in the panel. So it can be from their computer, it can be from home. They just go into the link, or it can be at school. We've done it in the school library. We've done it in the auditorium. Whatever works best for the school, and we conduct the panel, and then we follow it up with the student surveys, and then we give them the results. So they're able to show what the what the result is from everything that we do.
Data driven.
Yeah, of course.
I would imagine that when you work with the schools, since they always have, a new incoming freshman class every year,
Mhm.
that you typically work with the same school for a certain time period. And I also imagine you guys are consistently trying to like grow with the network of schools and the schools that you meet with. What does that growth effort look like for HealthWorks Academies when you're trying to um, bring in new schools for you guys?
Well, we try to get the word out as much as we can about our program, and we do, programs like this and others to let people know we are a best kept secret. But the we have uh, we have a vast number of industry partners and industry affiliates waiting for more schools. So the door is open for more schools, and there's no limit. Um, um, so just getting the word out and letting them know that we're here.
That you're here and ready and willing to help.
Yep, doors open, red carpet is at the door, and the welcome sign is up.
So one of the last questions I was hoping to ask you, and we do ask schools this question quite a bit on this podcast, is there anything that you would like to see happen local, state, or federal level of government that might make it easier for you guys to connect students with careers like this and basically like a little easier for you guys to function?
I would say that there are many programs for apprenticeships. And I know here in Pennsylvania, we have significant funding for apprenticeships, and that's a wonderful thing. But I would love to see that expanded for programs that invest in students' career development, because an apprenticeship is not really appropriate for every career trajectory,
Right.
but career awareness is critically important, and we just don't do enough. Industry is moving at the speed of light, and education is trying to serve so many masters. They just don't often know about these career opportunities and where the industry is going, where the trends are going. So a program like ours is invaluable for students and teachers and counselors and principals and outcomes data to be able to demonstrate that they're educating their students for what's next. And I would love to see investment in that arena because it's so critically important. We see, tragically, we see kids that go to school and spend, a lot of money on education, and then low paying jobs when they graduate. And it's just an unfortunate setup. And with our connections with industry, we're able to connect with them with student with school with careers that are in demand, that are well paying and have a career ladder, and are much more likely to have the students be successful over their work lifetime. And we're really dedicated to the best possible trajectory for the students and to reach their greatest potential in their service to industry.
When we started the podcast, you had mentioned about the three goals that you guys have, connecting students, building the diversity, and preparing them for like the high level performance careers. Um, I'd like to know that if you were to have like your own personal billboard or like a message for a community somewhere, is there a motto or um, just a quick phrase that's kind of like your this is what HealthWorks believes in that you would want people to know about you?
Well, I think that our tagline says it all: transforming education um, and talent development. Um, what we see in education is very much what we saw when I was in high school. A lot of it hasn't changed. And we just don't do enough to prepare students for what's next, whether it's college or not college, or whether it's, a professional industry, a high level industry, an entry level industry, or career, but with the skills that give them the opportunity to grow. And and we know that the healthcare industry is changing. It must. The population is changing. The demands are changing. The workforce is changing. The cost of education of healthcare is growing at an astronomical rate, and we can't afford to deliver care the way that we currently do. And so, what we really want to see is the transformation in industry. That's where we go to work. We're in high schools, we're transforming the minds of students, we're increasing their awareness, we're connecting them with industry, and we're transforming their education so that we can transform this industry.
Well, that is a beautiful statement, and I think you guys are doing an incredible work, truly.
Thank
Um,
you.
Impactful goals will lead to impactful changes. Um, from your experiences, this is actually the last question I have for you, but from your just experience with everything that you've done, do you have any other unique moment or funny story or lesson that you've learned that you'd like to share with us?
Sure. It's funny that you asked that. Um, I had a job that I loved. I was working as an executive coach for a global um, um, leadership development company. I joined them because I wanted to make transformational change in healthcare, and that's what I had the opportunity to do, and I loved it. But when I saw the trajectory for population, cost, talent, um, all of the all of the trajectories were moving in the wrong direction, and saw that we were headed for a cliff. And that's where Health Works Academies initially started. But I had the opportunity, my husband was a physician, and we used to host dinners on Friday nights once a month. And we had specialists that we referred to that were our friends, and they're, the doctors, their wives, um, and sometimes the wives were doctors as well. So we would get together, different people, different groups, about once a month. But I had this wonderful opportunity to ask them, what was your almost certain future in high school? And they would smile and they would tell me about where they thought they were going to do and why, and then what happened. And what happened was always a happenstance. Every single time, the common thread, something happened. And I was able to ask that question of hundreds of professionals in the health sciences. And what occurred to me was, if all of these professionals who were making such a difference in their careers were only there because something happened, what would happen if we worked with high school students and we created the happenstance? And that's what we do with our panels. When they hear the stories, when they meet the people, and they meet people who look like them, and they see what they've done, and they see, where they've failed, they've seen where they've been successful, they see where they took a risk and an opportunity, but everything happened with a happenstance. And so with those panels, we create the happenstance where students look at something and see something that they've never seen before.
It's a lot can change in just one little moment.
And
So
that's exactly
providing those moments.
That's exactly what we found with everyone I talked to. It was really striking, but everybody had that single moment where something happened and it changed their path.
That's a beautiful story. I
Yeah.
really, I really like that a lot. And it seems like the roots of HealthWorks Academies is very pure.
Thank you. Thank you. We're excited about this work, and
Yeah,
it's very gratifying. And there's something very magical about having students see something for themselves that they never saw before, because it changes their academic performance, it changes their behaviors, it changes their vision of what's possible. And that's where the light bulbs go on, and it's just a beautiful thing to see.
very fulfilling. Very fulfilling.
Thank you.
All right. Well, I believe we are out of time, so we're going to wrap up this interview. And thank you very much, Dale, for coming on and sharing us with all about what HealthWorks Academies does. I think you guys have a wonderful mission and something that's very important.
Thank you, Jared, and thank you for the opportunity to share our mission with your audience. I
Oh,
really
it
appreciate the
was
opportunity.
it was our pleasure. And everyone that's watching, tune in next time. And we hope you have a great day.
Thank you.